Hey everyone, finished another Tuesday clinic, and a couple thoughts, or maybe one main thought that just keeps repeating itself in our space. So when patients have persistent pain problems or an array of different symptoms in their pelvis, they, with time, create a narrative, what they believe to be happening in their pelvis based on where the symptoms are felt, what they're associated with, bowel, bladder, etc. And I've been finding a lot of people have this repetitive belief that a certain organ is painful, or there is a pathology in a certain organ, or that there are adhesions between particular organs based on how something is felt. And we don't always confirm that. In fact, we often confirm that the organ in question, or the organs in question, appear normal. So what does that mean? When we're doing the scan, when an expert sonologist or a team of experts is doing the scans, there are certain things that we can indeed believe. That's not always the case when a non-expert is doing an imaging test like an ultrasound or an MRI, but for certain things like adhesions between the uterus and the bowel, or ovarian cysts such as endometriosis, these are things that we can safely rule out when we don't see them on ultrasound. That's really important, even though the experience might feel different. The organ or organs may be anatomically normal, but they're not felt that way. Pain is always real, always, always, always real. The brain is interpreting something happening, but what it is interpreting is not always correct. What has been the narrative that has been created with time is not always correct, even though the feeling is real. And so what we have to do is we have to help patients understand what is really happening and what is not happening, so that way the brain can create the true narrative of what is happening and understand the events of the pelvis in a true way. Certain things that are experienced, such as pain, can lead to a sense of fear, because pain is almost always meant to be interpreted by the brain as a danger event. And when that happens, when fear happens, anxiety happens, uncertainty happens, these experiences can lead to an exacerbation of pain. And the pain system, which is part of the nervous system, can create negative loops where these issues can become persistent and repetitive. And there's also some anticipatory aspects to pain as well. One of the challenges is that this is very confronting, to have a patient come to the clinic with a fixed belief about an event, something happening in their pelvis, and us telling them that that is not happening, or us telling them that something else is happening altogether. And most people who come to us don't have a sense of trust around healthcare providers, don't have a sense of trust around imaging tests, and there's a lot of validity to this distrust. But I hope that people can try as best as possible to trust us and know that we are trying our very best using the latest evidence-based imaging techniques, and also cognizant that we could be wrong, and we have to be open to that as well. If things are not going down the right path, we always need to consider reevaluating the scenario. But we are really trying our best to help people understand the true narrative of what's happening in their pelvises to get them on the right track.